Welcome to Union Catholic Spotlight Series. Spotlight number 5, Health and Safety. The health and safety of Union Catholic students, faculty, and staff is our number one priority. The UC administration reviews all information provided by the CDC, the State of New Jersey, and the Archdiocese of Newark. Discussions take place with other schools and districts to share best practices. We engage professional experts to glean knowledge from their experience in the health and safety field. Our ultimate goal is to provide a safe and healthy learning environment for each member of the UC community. Building preparation for return to school. Building cleaning, sanitizing, and facility upgrades began in March to ensure that Union Catholic was ready to safely welcome back our students. The main hot water heater was replaced to ensure proper hot water temperatures throughout the building. Classrooms in need of painting were completed. Floor tiles in need of repair were replaced. The school camera system was upgraded. Filters for air conditioning units have been maintained as per manufacturer's recommendations. In addition to their annual cleaning, the following areas were also sanitized: carpets throughout the building, windows throughout the building, the gymnasium, cafeteria, and auditorium have all been cleaned and sanitized. To further safeguard our students, every classroom, office, and common space at UC received an antimicrobial surface protector treatment. A professional team was hired to electrostatically apply a hospital-grade disinfectant to all surfaces. The Global Virus Network confirms findings that this formulation eradicates SARS and COVID-19 on surfaces and provides continuous residual virucidal activity for up to 3 months. All remaining original water fountains in classroom hallways have been replaced. The contactless bottle filling feature is still available. The drinking fountain feature has been locked during this time. The girls' and boys' restrooms, as well as faculty restrooms, have been upgraded to contactless sinks and flush devices. Restrooms will be monitored to maintain social distancing by restricting admittance to a maximum of 4 students at one time. There is a maximum capacity sign on the restroom entrance door. Union Catholic will be using a computerized COVID-19 screening tool to assist parents in monitoring each student's daily health and to limit building access to those who exhibit no symptoms of COVID-19. Parents or guardians will be required to complete the COVID-19 screening tool each day your child will physically be in school. They must take the temperature of their child each morning and include that temperature when answering several questions in the daily COVID-19 screening tool form. Please submit the form just one time each day you are in school. After completing the COVID-19 screening tool, a barcode will be emailed. Parents should then forward that email to their child or take a screenshot of the barcode. Each student will need to produce the day's barcode on their phone or as a paper printout to gain access to the building. No barcode means no entry into the building. This procedure will apply to all students, faculty, and staff. Entrance to Union Catholic will be limited to 3 doors. Door number 1, the main entrance, for those arriving by bus. Door number 5, the auditorium entrance, for those arriving by car. Door number 12, the gymnasium entrance, for those arriving by car. These 3 doors will be open between 7:15 a.m. and 7:55 a.m. As you approach the doors, please form a line and maintain 6 feet of distance from the student in front of you. The ground has been marked with blue tape to indicate proper social distancing. If you arrive after 7:55 a.m., only door number 1, the main entrance, will be open for access. Barcode scanners will be located at door number 1, the main entrance, door number 5, the auditorium entrance, door number 12, the gymnasium entrance. Approach the scanning station with your mask on and your barcode ready. Hold your barcode under the scanning eye and wait for approval. Enter the building and sanitize your hands via contactless dispensers located at each entry door. Until further notice, there will be no family members, alumni, former faculty, staff, or visitors allowed in the school building, except in an emergency. Union Catholic floor puddles have been placed at 6-foot intervals in hallways and stairwells to encourage social distancing. The floor puddles will help direct traffic patterns, and additional signage will identify in-out doors in common areas. Hallways and common areas are equipped with hand sanitizer dispensers. Masks must be worn at all times in the school building, other than when a student is seated in the cafeteria eating. Capacity in the classrooms will be capped to guarantee social distancing. Students in periods 1, 3, and 5 will sit in certain seats, and students in periods 2, 4, and 6 in other seats. Desks will be labeled by periods so that spacing is maintained and so that no one sits in a desk immediately following another student. Seating has been arranged such that individuals will be facing the same direction when possible. When weather allows, windows will be opened to allow for greater air circulation. Where necessary, plexiglass social screens have been installed as a precautionary barrier. Each classroom is equipped with disinfecting wipes and hand sanitizer for student use. During period 4, UC has 3 lunch periods. Each cafeteria table will only have 3 chairs, 1 blue, 1 yellow, and 1 orange. The tables will be spaced out accordingly. Lunch periods will be color specific so that students do not sit in a space or chair that someone else used during that day. Microwaves have been removed from the cafeteria. Breakfast will not be offered, and the cafeteria will not be open to students other than during their scheduled lunch periods. Students are required to wear their masks while walking in the cafeteria. The mask should only be removed when they are seated for eating. Plexiglass social screens have been installed as a precautionary barrier in the main office. Faculty and staff will not be signing in at the main office counter so as to minimize foot traffic in the main office. Attendance will be recorded via the screening tool for all students, faculty, and staff. During the school day, high contact areas will be wiped down several times a day. Bathrooms will be cleaned twice during the day and then again after dismissal. Union Catholic has purchased multiple UVC surface and air sanitation machines. To effectively disinfect a space and keep it safe for occupants, equipment that disinfects the air is needed. The CDC recommends using UV germicidal irradiation as a supplement to inactivate the virus. These machines are generally used where disinfection is the primary concern, such as air and water purification and sterilization of medical instruments. The UC machines will be used at the end of each school day. The UC maintenance staff has been trained on proper usage and safety measures. They have already begun using the devices throughout the school. Union Catholic has established an isolation area. If a student, faculty, or staff member becomes ill on campus, the school nurse will be notified immediately. The nurse will instruct the student to report directly to the isolation area. Students who are ill should remain in isolation with continued supervision and care until picked up by an authorized adult, as they will not be allowed to travel on public transportation. Faculty and staff members who are ill should leave work immediately and seek medical attention. New ID badges and lanyards will be provided for every student. Photos will be taken at the beginning of the school year. Students will be required to wear their ID badge so that it is visible at all times. For the health and safety of all, the following areas are closed at this time. We will advise when they are reopened: student lockers, gymnasium locker rooms, and the weight room. As of today, Union Catholic has taken all possible precautions and measures within our control. We know that this is an ongoing process that must be reviewed and revisited regularly. Because, as I stated at the beginning of this message, the health and safety of UC students, faculty, and staff is our #1 priority.